Short term, we have a lot of data. Long term, well, when it comes to TAVR, we need some more. And so we're talking about a 2-year analysis of no-option patients who underwent TAVR for advanced aortic stenosis. And I'm with Dr. Stephen Yakubov, MD, Medical Director at OhioHealth Research Foundation and the System Chief of Advanced Structural Heart Disease at OhioHealth. This is an extreme risk cohort of patients, correct?
That's correct.
Now, you're taking a look at 2 years. What did you find?
We found that the overall risk of stroke and the overall mortality in these patient populations was significantly better than medical therapy.
And these patients often had heart failure at baseline, correct?
That's correct.
What happened? At 1 year, 2 years, what are you seeing?
We had matched cohorts of patients. So the patients were analyzed initially and then they were followed for 1 year and 2 years. And we found that initially over 90% of the patients were class 3 or 4, right. New York Heart Association functional class. At the end of 2 years, they were 94% class 1 or 2. So their quality of life improved dramatically.
Yeah.
Yes.
What do you think of the take-home messages from this follow-up? I mean, it's certainly encouraging news.
Sure. So number one is we have an alternative therapy that I believe works really well for improving quality of life and reducing mortality in patients who you thought had no option before. They really were turned down for surgery.
These have to be happy patients given the fact that their symptomatology is dropping precipitously.
We have a lot of happy patients.
So are you going to continue following these folks?
Yes, we'll continue to follow them. You'll see further reports of 3 and 4 and 5 year data down the road, and I think that helps us as clinicians do the right thing.
Now, over the course of the 2 years, what kind of problems came up? Any?
We saw some initial problems after the first procedure, but the changes that occurred from the time of the procedure, from the end of 1 year to 2 years, were minimally different at all, almost negligible.
So the benefits accrue up to a full year, and then after that, you're holding steady, and the patients are still doing as well, despite the fact that these were kind of really high-risk patients at baseline.
They are very high-risk patients at baseline, and we're very pleased with our mortality outcomes. We're very pleased with the valve performance, and we believe we continue to give great quality of life to the patients and improve their mortality.
And there's a cost analysis too that we've talked about that is showing really good signs too. So congratulations.
Thank you.
I think this should be interesting to follow as we go along 3-4 years and see where we're at.
Thank you very much.
Now, we have a lot of coverage from TCT. It's a cover story that you should be looking for in CardioSource World News Interventions, where I am the executive editor, Rick McGuire.